New Bedford's a one-of-a-kind place. We were once the whaling capital of the world, the wealthiest city per capita in the United States. Then we became a manufacturing center. Since then, we've become the #1 commercial fishing port in America, and we're about to become the birthplace of the offshore wind industry, and we are one of the leaders nationally in solar energy and energy efficiency. We are a place that reinvents itself every few years, and I think that's really the source of our strength. We're forward-looking, and we believe in a better tomorrow.
What we see now is really a climate that is in recovery, and a lot of the lingering health issues are here. We have a lot of chronic disease problems. Even though things are improving, we have a way to go. Public health and prevention now really have a seat at the table with the Affordable Care Act. We're participating with community-based vendors in filling in the gaps in care that are at the community levels. 3 major programs that the Health Department has launched in the last year: the Health and Oral Wellness in Schools program, the Health Access Kids program, and the Southeastern Health Initiative for Transformation program, or SHIFT program. The Health Department has started to move into this entrepreneurial space where we provide care and then we are able to bill mass health insurance for those services and recover the costs. 75% of the City of New Bedford residents are eligible for mass health insurance, which is our equivalent of Medicaid, and CHIP, which is a child health insurance plan. The Health and Oral Wellness in Schools program was really a pilot program that the New Bedford Health Department and the New Bedford Public Schools undertook in 2012 using funds from the Mayor and the City Council to test whether we could deliver preventive dental services, and that's screenings and varnishes and sealants, to public school students on public school time.
The Health and Oral Wellness School program is a great addition to our schools. We have 26 schools, and it is in the schools that is able to help us determine the health needs of our children and be able to respond to them very quickly so that their health issues do not become a barrier to their being able to learn effectively every day of the school year.
Last year we served 2,000 students, 30 of whom had never seen a dentist in their life. About a third of them spoke a language other than English at home, and about a third of them were actually uninsured.
We have health insurance, but we don't have dental insurance. That's separate for us. Through the house program, we were able to find the proper health insurance, and we were able to follow through with our doctors.
We partnered with the New Bedford Public Schools and the Greater New Bedford Community Health Center to apply for a grant with the National League of Cities. And we created the Health Access Kids program, which really aims to boost insurance enrollment for students and families, but more importantly, to keep them retained in health insurance and then track their insurance status over time so that before they fall off their insurance, we can make sure they're stayed enrolled and retained in the program.
We have healthcare access workers that go into the schools and help the families in their home language fill out the paperwork, and they go right through the process with them till the end until they have their health insurance. That way these children can see local dentists, they can see local doctors, and even the specialists.
Cities are a key entity in connecting children and families to health insurance. Mayors have a bully pulpit that they can use to spread the word about the importance of health insurance and where people can get assistance and how they can get enrolled. Mayor John Mitchell is doing that work. He's reaching families, he's using the bully pulpit, and he's connecting more children and families to health insurance. And as a result, New Bedford has stronger, healthier families.
To decrease smoking in the region, it's really a coming together of the partnerships in the community as well as Southcoast Health. And so we're privileged to be working on the federal grant Voices for Healthy Southcoast, as well as with the City of New Bedford as they ban smoking in public places, the New Bedford Housing Authority who's banned smoking in their facilities, and of course Southcoast Health is a smoke-free campus, and we've produced and brought forward the Breathe Better campaign. Today we're on board our mobile health van that provides education, screening, and immunizations to the community. The folks that staff our mobile health van are certified as smoking cessation educators. With smoking cessation specifically, over the last 2 years we were able to reduce the rate in New Bedford from an average of about 30% now at 19%. So a dramatic reduction.
Mass in Motion is a statewide initiative funded through the Department of Public Health, which focuses on policy, environmental, and system changes to prevent obesity and chronic disease, primarily through healthy eating and active living. We formed the New Bedford Bicycle Committee in 2011, who have been instrumental at helping us to achieve an additional 8 miles of bike lanes in our city.
New Bedford has really been full force ahead with this idea of changing the conditions in people's lives, so the healthy choice is the easy choice. We're one of our inaugural Mass in Motion communities to really think about health in all policy, a multi-sector approach to public health and health improvement.
What we believe we need to do in the long run is grow the health department capacity, and we're doing that. We're funding different programs in different creative ways, some directly from the city government, some through other sources. We really want to institutionalize good practices. We can leave a legacy of excellence that will sustain public health in the long run.